Hey, Viva Lifers. This is Dr. Kelly Young-Dee, board certified OB-GYN and healthcare executive, here to help you live your healthiest and wealthiest life. For us, that's called Viva Life. And the way we do it, spiritually, physically, financially, mentally, and emotionally, is to bring forth people who help us live our Viva Life 5 through meditation, journaling, exercise, optimizing our nutrition and our sleep, help us eat our Viva Life 5 foods, fruits, vegetables, nuts, beans, grains, and drink lots of water. And of course, help us with many different exercises, resources, and tools so that we can live our healthiest and wealthiest life. And our wonderful, amazing, and magnificent guest tonight is Dr. Becca Jacobs. She is going to tell you a little bit about ourselves, and we're going to go ahead and get started. Dr. Jacobs?
Hi, my name is Becca. I am a pelvic floor occupational therapist, and I'm located in San Diego. So I just launched my own practice in San Diego. I can see people in person and virtually, which is very exciting. I've been working for about 3.5 years as a pelvic floor therapist and absolutely love it. I see people of all genders, diagnoses, conditions, and symptoms. So you name it, I've probably seen it, probably treated it. And yeah, I'm so excited to be here today.
Well, we're definitely excited for you to be here because when I started in GYN, nobody knew what a pelvic floor physical therapist was. And I felt like we were explaining so much to people. So we're excited to hear about that. But I want to know a little bit about Dr. Jacobs. Why did you choose to become a pelvic floor physical therapist?
A couple different reasons. My primary reason is I was working with geriatrics and I saw a lot of incontinence pretty constantly. And I knew there must be something that we can do. So I started researching, and I also had this really intense interest in maternal health, maternal care. So I honestly stumbled upon pelvic floor therapy, and I dove in. So I have never looked back. I absolutely love it. And I've really explored so many different areas within the pelvic floor therapy realm, and it's just been fantastic.
Well, we can't wait to hear about it. Thank you so much for taking on this passion of yours because we need it so much. But we can't wait to hear what you have for us tonight. So go ahead and jump in and let us know about pelvic floor physical therapy and what you want us to know tonight.
Sure. So the topic is like pelvic pain associated with intercourse. So there are tons of reasons why people have pain with sex. Physical reasons, that's like the umbrella. And then we have under that things that can cause more physical pain are an emotional impact or like a situational situation. So we have, starting with those physical conditions, we have those tight pelvic floor muscles that can come from posture, from our gait mechanics, how we walk. And then it's also caused by weakness. So people who have weakness in their pelvis will actually have this really tight musculature in their pelvic floor because it's desperately trying to hold on. So if you think about that, when you're talking about sex or penetration or even the ability to achieve an erection, it's not going to be as comfortable or even possible sometimes. And so physically, we can work on those symptoms, kind of down regulating the system and getting everything to work in synchrony. But then you add in these other factors. So we have the emotional factors, and that is a person's relationship with their partner, or a history of trauma, a history of surgery, or a view of your body that is not exactly positive, that can impact how your body responds to intimacy, touch, or even just an emotional connection. So looking at how our patients' emotions and their life experiences affect their physical being is something that I think is so important, because it's really the only way to unravel the patient's reasoning and their body's reasoning for responding to intimacy and sex in a certain way. And then finally, the third reason is situational. So I have patients who, they are 6 to 8 weeks postpartum, and they try to have sex with their partner, and the baby's crying in the next room, and they're nervous, and there's the lights are on, and it's just not the right situation. Everything is off. So my job in that situation is to kind of unpack that, kind of go through, okay, these are the things we can change. And then we'll look at the physical factors, absolutely, because usually there's scar tissue or there's tight muscles after delivery. There's so many reasons they might have pain. But if we can change the situation a little bit where the baby is asleep, the lights are down, they are calm, maybe things will be a little bit more comfortable. So looking at the big picture is my job, finding out why their body is responding to penetration and stimulation in a certain way that's actually eliciting pain rather than pleasure. So we've got very complicated diagnoses. So things like vulvodynia and vestibulitis and things that are more, there's the emotional impact and also things that the person was just created with that we have to work through. But then we just have scar tissue and temporary changes in their body. So hormones is another huge area that I obviously refer out, but I see so many of my patients who were able to get 80% better, but that 20% is actually their body needs that regulation of an additional supplement of hormones. And we see an enormous change in their tissue after they have that supplement. So there's so many factors in pelvic pain and pain with sex that it's hard to just see just the physical part. So that's my job, is especially as a pelvic floor occupational therapist, I see the mental health aspect of things and the behavioral aspect, and will help the patient unpack that and kind of rebuilds their experience and their view towards sex and intimacy. So real quick, the treatments that I do, a lot of it is conversation. Again, like unpacking everything that's going on, talking through their symptoms, and really just understanding their personal experience. And then looking at their external structures. So how do they sit? How's their posture? Do they have a pelvic tilt? When they breathe, are they able to get their ribs expanding, their belly expanding? Because all of that plays so much into the pelvic floor. And then finally, we can do an internal assessment, which is either through the rectum or the vaginal canal, depending male or female. Females, we can do either. And we're feeling for those tense muscles. So basically, I am able to find every single muscle in their pelvis that plays a different role. So it might help with continence, might help with constipation, so many different things that we can discover with the internal assessment. And all of those different views of the patient, the external assessment, internal assessment, and their life experience, all of that puts together a picture of what's going on, and then we're able to move forward into a treatment plan. So I want to give you one little fun fact about the male population that I have discovered is it's so common, but people don't really understand. First of all, again, men can have pain with sex. And one of the triggers that I see a lot is actually the hip muscles refer pain to the testicles, which is a very interesting factor when you look at all of these men who are athletes and who are, they actually may just sit all day at their desk. And then all of a sudden they've got this unexplained pain that most of them are not excited to talk about. And that's my role. So seeing this different view that this pain that usually is seen as so medical is actually just their muscles telling them something, sending them a message. So finally, I want to give you guys a little tidbit, something to carry away with you today. One of the best things that you can do for your pelvic floor is take deep breaths. At the end of every day, taking belly breaths, letting your ribs expand, really getting your whole trunk moving, because that helps your pelvic floor relax, help with sensation, with blood flow, and with better orgasms. So enjoy.
I love it. You said so much there, and we're going to unpack some of that. Yeah.
Go for it.
So when you talk about pelvic floor pain, so those myofascial pain,
Mhm.
tightness, that's something that we talk about a lot in GYN, is people having really tight muscles. And we were
Mhm.
talking about doing that internal internal examination. I think people are used to the GYN doing the internal examination,
Yeah.
but then talk to you say, I'm going to send you to pelvic floor physical therapy, and they're going to do an internal examination. Can you kind of describe that? Because you said the word
Yeah.
vulvodynia, vestibulitis. So if you
Mhm.
can break down those two words simply for us, and then tell us what the internal exam actually kind of is.
Absolutely. And I even brought a prop with me.
Ooh.
I have my pelvis, my external pelvis. Okay, so we've got, first of all, what I have people come in, the first question is, what is this? Why am I here? I don't understand. Because, doctor writes the prescription and maybe explains it once, but nobody knows that we exist. So that's why I'm here. But pelvic floor internal and external examination is a lot less scary and invasive, I feel, than in the GYN's office. We don't use stirrups. We don't use a speculum. It's on a comfortable treatment table and you're covered with a sheet most of the time. I just peek under the sheet. And what I'm looking for, so I'm going to hold up my pelvis. So this is a female pelvis, but what I'm looking for in the beginning is, what do these structures look like? What does the tissue look like? The muscles? How does everything sit? Is there any tension that I can see right away? I'm looking to see, is there any redness, any swelling, anything that I need to know on the outside? And then I'll have them take a deep breath so I can see if their muscles move, because you can actually see when they breathe, if they're breathing correctly, if we're getting that lengthening of the pelvic floor. And then I will have them, I'll do a little external palpation. So kind of feeling the muscles, any tension, obviously gloved while I'm doing this. And just seeing if they have any sensory issues or anything else going on. So vulvodynia is when we've got some increased tension and sensory pain around the vulva. So some of my patients, they've had it their whole lives and they don't know life without it. So what we'll do is a lot of like desensitization of the vulva, work that's light touch, light pressure, and kind of teaching their body to downregulate. Vestibulitis is basically inflammation of the vestibule, which is right inside, so almost right at the vaginal opening. And same thing, it's inflammation, it's pain, it's a lot of heightened sensory awareness. So we work on that down regulation, on decreasing that heightened negative sensation and introducing a feeling of safety, because a lot of these conditions actually are associated with trauma or negative past experiences.
Yeah, that's so important. I mean, like you were saying, so when you say in vulvodynia, that's the labia, so the lips, that area, so large and small lips around the opening of our vaginas.
Mhm.
And then the vestibulitis is essentially the opening of the vagina, where people know where the hymen is and
Mhm.
where anything can go in or come out from that area. So that's what that sensitivity is. Okay, cool. Thank you for bringing the props. We love the props because that's
Of
very,
course, of course. And then real quick, the internal assessment is basically just one finger. It's just right inside the vagina or the rectum, and I am feeling all of these muscles starting here, and then I might go to the other side and test out the other side.
yes, and those muscles are called the levator ani, and they form a bowl. So you saw in her prop, it looks like a bowl right there. And those muscles, it's just like anything. First of all, if you don't use them, you'll lose them. If you overuse them, then you will get, spasticity, you will get Charlie horses, if you want to call it that, all of that. So it is a muscle. The male. So how do we get the men to come to you?
Um, Well, it depends on the symptoms. It's easy to get a male to come to me when they're having erectile dysfunction or incontinence. A lot of the other issues, I see that my male patients will wait a little bit longer, that pelvic pain. So convincing them that they will they'll be able to do all of the things that they want to be able to do. So for most of my male pelvic pain patients, it's sporting activities or the ability to sit at their desk and finish their work activities. So using that as a draw, hey, you'll be able to actually get things done if you go see Becca, if you go see a pelvic floor therapist. But it is hard to convince them to take that step. We definitely have fewer men than women.
I can probably, yeah, I'm just thinking, I'm like, yeah, once you, and then when you talk about the internal exam and the rectal exam and all that, I'm sure they're like, yeah, I'm
Which
not really.
is, I will say, it is not compulsory. You don't have to do it. And I will always give my patients the choice. Obviously, it's entirely based on their consent. So with my male patients, often we can kind of unpack and unravel what's going on without doing the assessment internally to begin with. Sometimes there's no way around it. I know exactly what muscle it is, and I can release it if they'll just let me. But there are times when we don't have to do internal.
Okay. So another question that came up is the question, it's from the kind of the male standpoint. You know, a lot of men have, you said erectile dysfunction, but they also have inability to empty their bladder, men and women. But I could imagine doing exams on people that you may be the first one to find testicular cancer or benign prostate hyper enlargement of the prostate, or even prostate cancer. Can you kind of address that?
Yes, typically, thankfully, that has not happened yet. But I do have coworkers who have found a lump on the testicle or have found that the prostate is just incredibly enlarged. And typically our patients are aware because most of my patients start by going to a urologist or their primary care doctor who will go through all of those assessments first. And my viewpoint on doing internal and doing external assessments is I will make sure that the doctor is fully aware of the patient being in my office so that if we do find something, it's actually much easier for them to go see their doctor. And I will always, if I have a concern, I will always address it with my patient. Hey, I found this. You definitely should make an appointment, but try not to panic. And usually, you know, I've been met with very positive responses, even something that's incredibly benign. I want my patients to go see their doctor before we do anything further.
All right. Well, we are coming towards the end. If anybody has any questions for us, go ahead and put them in the chat or come off mute. You are welcome to. But Dr. Jacobs, go ahead and let them know how to get in touch with you. And you said virtually too. So this is a game changer. Let them know how to get in touch with you.
Absolutely. So I put my website in the chat. It's foundationspelvicwellness.com. I also put my phone number up there, but if you go on the website, you'll find my contact information. I'm still getting my social media up, so hopefully you'll see me there soon. And I do virtual visits. I do wellness visits if you're out of California, so it'll be a different kind of format. But if you're in California, I will see you full on as a pelvic therapist. So reach out and we'll have a conversation.
Love it. And how many sessions do you think is good for managing pelvic pain?
I typically see pretty good results depending on what's going on. 6 visits is usually my average. So, but it could be anywhere up to 12. It could be just 3. Who knows?
All right. Well worth it, y'all. Well worth it. Go ahead and invest in yourself. Use your health savings account or your cash and make sure that you go ahead and invest in yourself. I'm Dr. Kelly OMD. You know where to find me, drkellyomd.com or on Instagram at Dr. Kelly OMD. We have a lot of packages available for you to continue with the Viva Life experiences and programs. And we are so happy to have you here. Remember to share, like, and subscribe to Viva Life Health Hub. Go ahead and Google it. We're all over. Have a wonderful evening, everybody. And don't forget to do what? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly Young-Dee, board certified OB-GYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.